Hello anatomy friends, this is Dr. Alsup and we have arrived at station number 2 where we are going to focus on a lateral view of the cranium. So when we're looking at this lateral view, there are a few bones that you can see most obviously here. You will have the frontal, you can see one of the parietal bones. The largest structures here, or largest bones you will see, are going to be the temporal bone, so you only see one. You can see a bit of the occipital bone back here, some of the sphenoid, and the zygomatic, really, in terms of the major bones that you can see in this lateral view. You can see a bit of the face, but that's easier to see in a more anterior view. We're going to focus on the parietal and the temporal bones. And so on this parietal bone, there are going to be two main lines that are going to be in variable size dependent on how robust the musculature is that is going to form these lines. And you can see that they even extend a bit into the frontal bone region. But for our purposes, we're going to focus on the parietal bones because that tends to be where they're going to be more robust, or these lines. So the superior temporal line is going to be associated with the attachment of the temporal fascia, and the temporal fascia will cover the temporalis muscle. And the superior-most attachment for that is going to be on this inferior temporal line. So temporalis muscle, if you put your hands on where you generally think of where your temples are on the side of your head and kind of clench your teeth, you can feel a muscle under there contracting, and that is your temporalis muscle. So this will be the superior most attachment for that muscle, and then the superior temporal line is where that temporal fascia, or that muscular fascia, is also going to attach. Moving to the temporal bone region, you have this fairly complex bone. And I love how complex it is here. You have this kind of squamous portion right here, and then all the fun really starts happening on the inferior portions of the bone. So you can see this extension right here of the bone referred to as the zygomatic process. So it is that process that is heading towards the zygomatic bone. This area right here, which is not on our list, but this is the temporal process of the zygomatic bone, and if you put these two together, these will form the zygomatic arch. So this will be an important attachment point for the masseter muscle, which is going to be another one of those muscles of mastication. You can see a little inferior projection of the zygomatic process right here that is called the articular tubercle, and this is a fairly small tubercle in comparison to some of the others that we have seen or will see. But this is an important area because it's going to be the kind of anterior boundary of where the temporomandibular joint and all of its associated structures are. And if you have a dislocation of the TMJ, typically what will happen is that mandibular condyle that typically sits right here will actually move anterior to that articular tubercle. And so that would be a case of dislocation right there, and that's the most typical way that you will have the dislocation occur. All right, let's look at this gaping hole right here. This big hole right here is referred to as the external acoustic opening, which leads into the external acoustic meatus. That meatus is basically a tunnel into a certain region, and what it is leading into, it's kind of this external ear region leading to the tympanic membrane, aka, or more colloquially referred to as the eardrum. And so at that eardrum, once you're past that or more medial to that, then you're in the middle ear. So this is leading from this is external ear leading to the middle ear, which will eventually lead to the inner ear. This antero-inferior projection right here is the styloid process, and it is shaped, kind of needle-shaped or stylus shape. That's where it's getting its name, and you'll have many important ligaments and muscle tendons that are going to attach on this particular process. More posterior inferiorly, you'll have the much larger mastoid process. And this is the one that I keep telling you, if you kind of put your fingers behind your ear and feel a big bump, that is your mastoid process. And so there will be certain things that are attaching here, but importantly, the sternocleidomastoid will have one of its superior attachments associated with the mastoid process. And inside, if we were to open up this mastoid process and look at the internal portion, you would see a lot of little mastoid air cells associated with the mastoid process. All right, excellent. So there's a lot going on in this lateral view, right? So there is a lot of interesting structures, and I like kind of how we're focusing at each station at a different view and what the major structures are we want you to identify. Thanks for your time and attention here. Always feel free to reach out if you have any questions, and I hope you have a great rest of your day.